Hi, my name is Itati Almeida, and today I'm going to talk about therapeutic hypothermia in deceased organ donors and kidney graft function. Content: definition, applications in medicine, pros and cons, issue in Ecuador, and conclusions. Definition: therapeutic hypothermia, also termed targeted temperature management, is an established intervention that is used to protect neurologic function in patients with certain types of cardiac arrest.
After kidney transplantation, delayed graft function, defined by the need for dialysis within 7 days after transplantation, affects up to 50% of renal allografts obtained from deceased donors. While therapeutic hypothermia is an established intervention used to protect neurologic function in patients with certain types of cardiac arrest, the benefits of hypothermia for renal protection have remained uncertain. To investigate the role of therapeutic hypothermia in this setting, the authors randomly assigned organ donors after neurologic determination of death to one of two targeted temperatures: 34 to 35 degrees Celsius, the hypothermia arm, or 36.5 to 37.5 degrees Celsius, the normothermia arm. Temperature protocols were initiated soon after donation was authorized and ended when organ donors left the intensive care unit for organ recovery in the operating room. During the trial, 572 patients received a kidney transplant. Delayed graft function developed in 39% of those in the normothermia group as compared with 28% of those in the hypothermia group. The study was terminated early after a pre-planned interim analysis showed that hypothermia was associated with a significant benefit. This trial demonstrates that inducing mild hypothermia in deceased donors before organ recovery lowers the rate of delayed graft function in recipients. Full trial results are available at nejm.org.
Applications in medicine: delayed graft function, which is defined as the requirement for dialysis in the recipients within 7 days after renal transplantation, results in increased healthcare expenditures.
Hello. Today I've been reading a paper from Bromberg and colleagues published in Transplantation. This is a multi-center RCT from the USA with some quite interesting results. The study drug was ANG 3777, and this is a hepatocyte growth factor mimetic. It was administered randomized against placebo to renal transplant recipients with either a low urine output postoperatively or a serum creatinine that was not reducing at a required rate. It's a good quality double-blind randomized study with the control arm receiving saline infusions as placebo at the same time points as the study arm. The study drug was associated with an increase in urine output over the month of follow-up, reduced dialysis sessions, and reduced hospital stay compared to the control arm. Also, the study group was found to have better serum creatinine at multiple follow-up time points and better graft survival, although it is a small study of only 28 patients. The study was actually halted early by the FDA because of the significant efficacy findings, and a phase 3 study has been initiated. I think this shows very interesting results, but actually only 19 patients received the study drug in this trial. So I'm really looking forward to seeing what is shown by the phase 3 study. Thank you for listening. Let us know.
Pros and cons. Pros: the primary outcome, delayed graft function, the recipient's requirement for dialysis during the first week after transplantation. Cons: current protocols stipulate that normothermia, which frequently requires active warming, be maintained in organ donors. Issue applied in Ecuador: ischemia reperfusion injury during the transplantation process is a major contributing factor in Ecuador to subsequent poor allograft function.
Mike Newbert died October 20th, 2010.
The lights just went out.
His family will tell you his life began again
That's the last thing I remembered.
11 days later in the intensive care unit at Allegiant Health Midlands Hospital.
If you know my dad is a storyteller. And so he has some story to tell now because he survived.
Yeah.
Newbert, who's always been pretty active, dropped over from cardiac arrest at the school where he worked as a custodian.
The nurse in the school came right away and started administering CPR. They called the emergency unit.
They revived him and rushed him to a Bellevue hospital, but the doctors there couldn't perform the life-saving procedure he needed, so they sent him on to Midlands Hospital.
We've seen lots of patients that were in his exact situation just not survive.
Where Allegiant Health Clinic cardiologist Dr. Joe Thibodeau and his team were waiting.
And I think with therapeutic hypothermia, I honestly think he's here because we did it.
So what is therapeutic hypothermia, or code chill? On a cold day, we do everything we can to stay warm. With code chill, it's just the opposite. It's all about bringing the body temperature down, almost 10 degrees, to help the body heal.
And our goal is to get him down to around 91 degrees.
And to keep the patient there for 24 hours. Cool the patient quick enough, and you can slow or even reverse some of the damage that happened when the brain was without oxygen.
The faster you get somebody cold, the better they're going to do.
They start with cold saline or ice water through an IV, ice on the groin and armpits, and wraps on the patient's legs and chest.
The wraps are connected to these tubes which connect to this machine over here, and this machine simply cools fluid and circulates that fluid through the wraps in the legs and the chest here.
Mike Newbert doesn't remember any of this. He watched as Dr. Thibodeau detailed his stay.
Occur.
And learned why putting cardiac arrest patients on ice is critical.
Cooling the body slows down everything. And so we find that cooling the body makes people, in general, gives them a better chance of having a good neurologic recovery, being awake, walking, talking.
Well, what can I say?
Mike's living proof. One look at him and you would never guess he almost didn't make it.
Okay, absolutely lucky, 100% lucky. I get a second chance at 100%.
Mike is lucky. Lucky paramedics took him to Midlands Hospital.
This old goat make tired? What are you talking about?
And lucky his family opted for code chill.
Thank you. The words can't describe what they've given us. They've given us back our dad and our grandpa, and many more memories to be made.
All of Allegiant Health's 5 metro hospitals have procedures in place for therapeutic hypothermia. If you would like more information on therapy,
Conclusions. Mild hypothermia as compared with normothermia in organ donors after declaration of death, according to neurologic criteria, significantly reduced the rate of delayed graft function among recipients. Thank you very much.